Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And as regular viewers will know, I was recently in hospital. I had an appalling time, to the point where my wife, on a visit, decided enough was enough and pulled me out. She said, yes, it was against medical advice, but it was actually for humanitarian reasons. Kettering General Hospital, I thought it was just a bad hospital, which it is. I mean, a lot of people have written to me, or friends and colleagues, whatever, and they've all said it's a terrible, terrible place. My treatment there was very much subpar. However, it's not just Kettering. It's everywhere. It's the whole NHS. The whole of the NHS is failing, and it needs to be reassessed. It needs to be basically rebooted, with a lot fewer managers and with provision to ensure that it only treats those people who are entitled to its treatment. There is a report today that shows the shocking, shocking state of socialised medicine in this country, and I'm going to cut to it straight away. And honestly, don't get ill. Whatever you do, don't get ill in this country today. Let's have a look. My experience recently was appalling. I sat for 4 days in the same soiled cottons. I lay unbathed for 4 days. My primary underlying condition wasn't addressed at all. Did not see a consultant specialist in that field at all. And I slowly got worse and worse physically, and my mental decline was marked. To such a point, as I said, that my wife pulled me out. She couldn't stand the suffering I was undergoing anymore. I don't know why the hospitals are like this. They are given so much money. But a lot of it's wasted, of course, because you have 15 layers of management. And this is the problem you've got. You've also got a lot of wasted resources. You're getting people turning up and saying, oh, I need treatment on the NHS. Sure, fine. What's your national insurance number? Oh, we're foreigners. Okay, well, get in you go. Haven't contributed to it, but they're using it. This is why people are suffering. I want to make it clear, at no point will I be blaming any individual in a hospital. And when I say any individual, I mean any doctor, nurse, health assistant, healthcare assistant. None of them, even the cleaners, the auxiliaries, the receptionists, none of them are to blame. I accept they are doing the very, very best they can. I will put blame. I put blame at individuals, those individuals starting with the Secretary of State for Health and working all the way down to the chief executives and the board members of the individual hospitals and the senior management of those hospitals. When I was suffering, I know I was suffering not because a nurse decided I'm going to suffer, but because the nurse had too many patients in too many wards. The doctors were run off their feet. They couldn't get the medicine around because they didn't have enough pharmacists. The problem isn't the people. The problem is the lack of people. 1,000 patients a day are waiting 12 hours or more for a bed in accident and emergency. As a new report warns of serious and dangerous levels of crowding in hospitals. More than 1,000 patients a day waiting more than 12 hours or more in A&E for a hospital bed last year. And let me tell you, it hasn't improved. I went in at 4 o'clock in the afternoon and I didn't get to the ward until 11:30 at night. Not quite 12 hours, I grant you, but mine was considered a medical emergency. Imagine if it wasn't. The Royal College of Emergency Medicine said the alarming number of people left waiting on trolleys or chairs shows a deep crisis. It said its figures obtained from hospitals under the Freedom of Information laws, because otherwise the hospitals wouldn't have released it, highlight serious and dangerous levels of crowding. And I'm 55 and I saw things with elderly people that I hope I never see again. And I'm talking horrific levels of lack of care. And as I say, this isn't the nursing staff. This is the lack of nursing staff. The results show at least nearly 400,000 people had to wait 12 hours or more. But the true figure is likely to be almost double that, as only 74 of England's 124 NHS trusts responded to the request. So it's likely to be 2,000 a day. The NHS in England currently measures 12-hour waits from decision to admit, which is the point at which the doctor decides a patient needs a bed. It's a gross underrepresentation of the reality of patient waits, because many will have already faced a long wait in A&E before the decision is made. Indeed, you could be sitting in A&E for 4, 6 or even 8 hours before the decision to admit is made, which could then be another 24 hours, up to 24 hours before you get to a bed. You could have a serious condition and could be sitting there a day and a half. The health service is failing, and failure to act will take it deeper into crisis and inevitably lead to another worst winter on record and further patient harm. They added that staff work closely to ensure people leave hospital when they are fit to do so. Not this people. This people got out before he got any worse. Now, this is an appalling state of affairs for an organisation that is given untold billions a year. And we have to ask why it is. So I'm going to come up and I'm going to present a couple of reasons. So, what's the solution? How do we make the NHS workable? Well, firstly, you need to remove about half the number of managers. The savings in salaries alone, the savings in bureaucracy and paperwork will more than pay for several nurses, 5, 6 nurses a shift in every hospital. That would ease a lot of the problem. Secondly, as someone comes in, they're sitting there in the A&E and how will you be paying, sir? Will it be private insurance, credit card, or are you registered on national insurance? They give their identity and you go onto the computer and check, and if they're eligible for national insurance, that's fine, they go through. And if they're not, you go back to them and say, do you have private insurance? And if not, can we take your credit card, please? And amazingly then, you'll see a lot of people get off thy bed and walk. A bigger comeback than Lazarus. But they don't have any plans to do that, because that would require a spine. That would require someone with, well, a bag full. That ain't going to happen, is it? Because just look at the people running the NHS. We need a health secretary who's strong enough to administer this sort of thing. We need to cut waste, we need to cut management, and we need to cut handing out free services to everyone who's not eligible. And until then, the A&E departments, the whole of the NHS in fact, will just wither and die, and with it the health of the nation, the trust of people, the deep, almost religious belief in the NHS will have gone, because nobody will want to use it. And maybe that's the plan, I don't know. Anyway, I shall leave it there. If you like what you see and hear on the channel, please hit the subscribe button if you haven't before. Ring the bell for notifications of future output. Leave a like, leave a comment, and until next time, stay safe, stay well, stay healthy, and goodbye.